Hey everyone, and welcome back to my channel. This video is all about what I have in my emergency health kit, or my crap bag. So this is the bag I found on Etsy for all of my medical stuff, and I love it. It's Friends themed, and I love Friends. Who doesn't love Friends? And it's the perfect size to fit all of my medical stuff in, or most of it anyway. So I'll be going through everything I have in it that I take everywhere with me. I have a rucksack that has all of my stuff in, and this is one of the things that I have to take everywhere with me because I need so many things that people don't usually have. So the first thing I have in my bag is plasters, a lot of plasters. These are hypoallergenic plasters because I'm allergic to adhesive, and even though these have adhesive, because they're hypoallergenic, my reactions aren't as bad. In hospital, they always end up just taping over some gauze whenever you have a cannula out. But I'm allergic to the gauze, so I always have to have a plaster, just in case, because I never know what's going to happen. The second thing I have is some wipes. I usually have baby wipes, but I couldn't find a small bag, a small thing of baby wipes to carry with me. I use those to wipe my hands if I need to because I'm allergic to soap, or if I'm having an allergic reaction to adhesive or something on my skin, I'll have to wipe it off, and I have to use the baby wipes because my skin's really sensitive and because of my allergies. They're also really handy as well. They're not just a medical thing, they're actually really handy. I also have some hydrocortisone cream. I don't know if you can actually see that. Okay. It's just bite and sting cream, this one, but it has hydrocortisone in, which is a corticosteroid that helps reduce allergic reactions. So if you're going into anaphylaxis in hospital, instead of using epinephrine or adrenaline, they will use hydrocortisone or another corticosteroid because it's much safer for your body to have that than epinephrine. And this is topical hydrocortisone, so it's a lot different. And also, it's only like 1% hydrocortisone or something. But that's enough to reduce the allergic reaction on my skin, or eczema as well, it helps with. So I always have this because I'm allergic to so many things. I also have a lot of medication. I'm trying to find it all. I think that's it. So I take a lot of medications, like most people with chronic illnesses. And there are a lot of medications that literally keep me alive. It's not like I would die without them, but because of my allergies and because I have so many, I have to take at least four times the usual dose of one of my antihistamines. So it's an off-licence dose, and my GP has never prescribed that much. So I have, this is my antihistamine, and I'm missing one, but I have another antihistamine in there as well. I also have some emergency antihistamines, which I don't take every day, because I'm on a lot of antihistamines already. But if I'm having an allergic reaction for some reason, and my usual twice a day antihistamines aren't working, I've got some chlorphenamine, which is I think it's over the counter. It's just another antihistamine I can take because I actually react to a lot of antihistamines, which is kind of ironic because you're not supposed to react to them, but I do. So I have those in there as well. I also have some domperidone. I take domperidone for gastric emptying. I have slow transit, so all of my digestive system is super slow. And domperidone helps with nausea and vomiting, as well as speeding up my GI tract, I guess. It's a prokinetic, so it just speeds everything up a bit, or it's supposed to. And I find that if I don't take this, I feel really nauseated. So I have 2 days worth of domperidone in my bag just in case. I actually have 2 days worth of all of my necessary tablets, because I never know when I'm going to end up in hospital and if I'm going to have my tablets with me. And most of my tablets they don't actually have in the hospital, or not enough, or they won't prescribe them, or I don't know. But most of the time I never get them from the cart that goes round. I always have to use my own. And I also have sertraline. Because of my severe depression, I take 100 milligrams of sertraline every morning. And one time I was in hospital and I was supposed to be taking sertraline every morning, but I couldn't swallow. And they couldn't give it to me because I couldn't swallow. And they wouldn't even put it down the feeding tube I had at the time, which is really bad because I could have gone into withdrawal or something. Luckily I wasn't on as high a dose as I am now, but all of my other doctors, like my normal doctors, said I shouldn't have come off it. And then I also take nortriptyline for neuropathic pain or chronic pain, but because it's also an antidepressant, I feel that if I miss some doses, then I could feel a lot worse. So I just have some of that just in case. So that's one of the medication I take with me everywhere, literally. I have this medical alert card. Let's see if, yeah. So I got this from F&D Action. It's not like a general medical card, it's specifically for non-epileptic attack disorder. On one side it has my personal information and information for my parents, so their contact numbers, in case I'm out somewhere by myself or with a friend, something happens and they need to contact someone, or the hospital needs to contact someone if I'm there. I have 3 of these that I keep in different places. I've got one in this bag, one in my purse, and one in the back of my phone case. And then on the other side, I believe it's the side I showed you, it has what to do if I'm having a seizure. So because of my seizures, I have to be really careful about what I'm surrounded by, because they can be triggered by my allergic reactions, severe pain, noise, fatigue, like extreme fatigue, not my general fatigue. So if I'm having a seizure, the first thing it says on here is, if possible, guide me to a safe and quiet place, which is perfect for me because of my noise-triggered seizures. And then it also has other things, like generally for seizures, like don't put anything in the mouth. And there's also space at the bottom that I can write things on if I need to. And it says, don't call an ambulance unless I'm injured, or I can then write if it goes on for longer than 5 minutes or something like that. I haven't actually written on them yet. But it's really important for non-epileptic seizures, for me, not to call an ambulance straight away, because I hate going into hospital and that can actually make me worse. And also, because they're not dangerous in the sense that my brain isn't being deprived of oxygen, then I'm not actually getting harmed unless I physically injure myself. So an ambulance doesn't actually need to be called, which is very good actually, although most of the time they end up being called anyway. Another thing I have in my bag is a pulse ox. I was advised by a paramedic to get one of these, supposedly to reassure myself that I'm fine, but actually, a lot of the time, my oxygen has dropped or my heart is beating really slowly or really fast. So this can be a good indicator of whether I need to go into hospital or I need an ambulance or something. But sometimes it is actually to reassure myself and people around me that my heart and my lungs are working okay. I also have an acupressure band. I found these in a hospital that I was in, and I don't know if it's working, but it feels quite cool. And I thought I might just take one with me just in case. Because I have 3, so I do have a spare one and space in the bag to fit it in. I have so many things in this bag, it's ridiculous. I have a radar key. This is such a pain. So that's my radar key. I can't remember the company I got it from, but it wasn't very expensive, and it's actually really helpful because there are lots of disabled toilets that are locked, so abled people don't use them. So this can unlock a lot of disabled toilets in the UK, and it's especially important when I'm using my wheelchair that I have this with me, because sometimes I can't get up to walk to the normal toilets. Like I need to use the disabled toilet specifically, and if it's locked, then this is really helpful. I also have kind of a sunflower lanyard. I don't know if you've heard about these, but it's to help with people with invisible disabilities get help they need in public places. So you can wear it to the supermarket, and if the people there are aware of what the sunflower lanyard is, then they can come up to you and ask if you need any help without you having to tell them you have an invisible disability and need help. Obviously, not everybody does need help, but I like having this with me when I'm not using my crutches or my wheelchair, wearing it. And there are people there to help me if I need it. And I'd rather have someone come up to me and ask if I need help than to have to awkwardly ask someone to help me. You can also use these in airports as well. I'm not sure, but I think I read somewhere that the airport, either Heathrow or Gatwick, have a disability lounge. I'm not sure if they've actually brought it out or not, or if it's ever going to happen. But if you're wearing the sunflower lanyard, then you can get into that. So it's just a quiet place away from people, and you might be able to get some extra help or something. I don't really know. I have, along similar lines to the sunflower lanyard, I have this "Please offer me a seat" badge. So I got this from I got this from Transport for London. I don't live anywhere near London, but I'm in an area that they can send these out. So I have the Please Offer Me a Seat badge, which I haven't actually worn yet because most of the time I'm out, I'm in my wheelchair or I'm using crutches, and if I'm using crutches then people generally offer me a seat. But that's just in case I need a seat and someone won't give me one or something like that. It also came with a credit card sized card that has the same information on but also says something like, please remember not all disabilities are visible. So that's really helpful. I also have emergency paracetamol, which I completely forgot I'd put in. I don't take paracetamol every day. I rarely take it because my stomach hates it and I don't like taking it because it doesn't help me anyway. But if I'm in really, really severe pain or I have a headache, then sometimes I might take some because I can't take opioids or non-steroidal anti-inflammatories because of my gastro issues. So paracetamol is really the only medication I can take for it. And I have some in my bag just in case I'm in pain or have a headache, just to try and prevent my seizures. It doesn't always work, but on the off chance it does, rather have some than need some and not have any. I also have 3 different earplugs, which might seem excessive, but they're all slightly different. I have hypersensitive hearing, and lots of places, especially hospitals, are really noisy. So I have some that try and block out background noise and dampen down people talking and things like that, which can just take the edge off. And then I also have some, which are the blue ones, which are supposed to block out as much noise as possible. So I only wear those if I don't need to hear anyone. I'm nearly at the end. I have a red wristband. If you didn't know, if you have allergies, they'll often give you one of these at hospital and write your allergies on it. I have a lot of environmental allergies, so I don't get a red wristband for those, but I also have a drug allergy and drugs I can't take for various different reasons other than allergies. Usually they'd be cut off, but this one was actually too big, so I managed to just slide it off my wrist, and I thought it might be helpful if I end up in hospital again, because I think they're made of plastic, so help the environment and have this thing to save me, really. Finally, I have a stretchy thing that goes over your arm on top of your cannula to stop the venflon or the little coloured cap popping open, because that can expose your bloodstream to germs. I rarely get given one, but one time I was in for a couple of weeks and I was given one of those because I was on a drip overnight. And I actually kept it so I can put it over my cannula whenever I get one to try and stop me itching it because I'm allergic to the adhesive, and also to stop the venflon from opening. And I believe that's everything. Obviously people have lots of different things that they need to take with them. So I didn't used to have a bag like this because I didn't need one. And then it all just started building up, the things that I needed to take with me. So I put them all in a bag, which I take everywhere with me now. But people with different illnesses, or even the same ones that have different symptoms or need different things, will have different things in their bag, or they might not even need one. So that's just my bag. But that's it for this video, and make sure you click subscribe down below, and I'll see you next time.